Good afternoon and good morning, everyone, whatever time zone you are in. Thank you so much for joining us today for the NEHA and ecoAmerica webinar, a sneak peek at 2 AEC climate and health sessions. I'm Vanessa DeArmond, and I'm the project coordinator for the National Environmental Health Association's Climate Change and Sustainability Program. NEHA and ecoAmerica are hosting this webinar to preview 2 climate and health presentations at NEHA's 2018 AEC and HUD Healthy Homes Conference, the Climate for Health Ambassadors Training, and the latest NEHA Climate Metrics Survey results, both on June 27th. This is an opportunity to get a sneak peek before the AEC and ask questions and learn more about these presentations. Before we get started, I'd like to go over a few logistics. All webinar participants will be in listen-only mode. This webinar is being recorded. If you are not okay with it being recorded, you can disconnect at this time. There will be a Q&A at the end of the presentation, so we will hold all questions until then. There is a Q&A will be conducted through the webinar chat box on the bottom left of your screen. Feel free to type in your questions during the webinar, and we'll address the questions at the end of the presentation. Also, if you are having trouble hearing me or the presenters, please also provide that information in the text box. Following the webinar, we will provide the information. There are some documents that the survey results from 2016 and 2017, as well as a PowerPoint. The PDF of this PowerPoint presentation will be sent to you following the webinar. Before I turn it over to ecoAmerica, I will provide a little background on NEHA's partnership with ecoAmerica and its Climate for Health program, as well as information about our conference. So, as you will see during the webinar, NEHA and Climate for Health are building visible national leadership on climate solutions and institutionalizing climate action as a health imperative. We're developing and supporting climate-literate environmental health professionals that can lead on climate, engaging all leadership, members, and stakeholders, and building collective support and action for climate solutions within the NEHA community and across the health sector. NEHA and ecoAmerica are partnering to bring environmental health professionals climate and health resources and training. NEHA's Climate Change Committee is instrumental in developing these resources, and some are already available. NEHA's Climate Change Policy Statement, written by NEHA's Climate Change Committee, the Climate and Health Metrics Surveys, that you will hear more about in this webinar and at the AEC. EH and Climate Change blogs, one written by a member of NEHA's Climate Change Committee and a new one from NEHA staff. Climate Change Success Stories, also involving Climate Change Committee members. And of course the AEC sessions and more resources are coming. NEHA is very excited to be working with ecoAmerica on these and future projects. And speaking of the AEC, if you haven't already done so, register for the conference. The AEC is the event for environmental health training, education, networking, and advancement. For full conference registration, the member price is $715, and that includes the Monday through Thursday education and most events. For our single day attendance, the member price is $320. In addition to the climate and health track, the AEC will have educational tracks and sessions on built environment, emergency preparedness, water quality, vector control, environmental justice, and much more. For more information, please visit the NEHA website at www.neha.org and click on the AEC banner. I will now turn it over to ecoAmerica. Our speakers today are Megan Spicer and Layla McCurdy. Megan Spicer oversees the strategy and management of marketing, programs, and research for ecoAmerica. Before ecoAmerica, Megan helped launch and was the brand director for RED, the initiative to end AIDS in Africa. Layla McCurdy is the director of ecoAmerica's Climate for Health program. She has over 20 years of experience in public health and the environment. Her work experience includes the National Environmental Education Foundation, American Lung Association, and Johnson & Johnson. She is also the founder and chair of the Children's Environmental Health Committee of the American Public Health Association. Layla will now begin with an introduction and overview of ecoAmerica and its Climate for Health program.
Thank you, Vanessa. Greetings, everyone. It's a real pleasure to participate in this webinar. We at America are very, very excited about our partnership with the National Environmental Health Association. And Megan and I are looking forward to the NEHA conference and having the opportunity to interact with the members directly. Before we get into the preview of what we plan to offer at the conference, I would like to say a few words about ecoAmerica and our Climate for Health program. ecoAmerica builds institutional leadership, public support, and political will for climate solutions. We convene national events, bringing together prominent leaders from diverse sectors to build and share knowledge, forge new alliances, amplify collaboration, and inspire fresh strategies for effective climate action. We conduct research to understand which Americans are ready to move on climate and how to speak with them in ways that motivate action. Today, you will hear about the research we have conducted with the NEHA membership. We also create tools and resources for our partners. Again, today you will hear about our newest resource, and I will keep that for now for Megan to introduce it to you. But the program is called Climate Change and Health Ambassadors Training. As Vanessa mentioned, both of these will be presented at the NEHA conference at the end of June. Now a few words about Climate for Health program. Climate for Health is ecoAmerica's program that focuses on health overall. And it is a national initiative led by a diverse network of health leaders from across the health sector. And we are very proud that NEHA's Executive Director, Dr. Dave Dijak, has been a very active member of this leadership circle. We are collectively committed to advancing climate solutions to protect the health and well-being of Americans, and we support our partners and offer inspiration and resources to others to make their own commitment and build support for climate solutions. Now it is my pleasure to turn it over to Megan Spicer, ecoAmerica's Chief Engagement Officer, and she will give you the preview of the sessions she and I will be presenting at the NEHA conference, where we hope to see all of you. In the past, I had the pleasure of participating and presenting at NEHA conferences. And if you haven't participated before, take my word. You're going to be really very, very impressed and learn a lot, and will have a tremendous networking opportunity. Again, I look forward to seeing you there. and I appreciate the attention. And Megan, please take it away. Thank you.
Wonderful. Thank you, Layla, and thank you for joining, everyone. I look forward to the opportunity to meeting you in Anaheim in June. So what I'm going to do is first, I'm going to take you through a preview of the results of our survey. I'm going to talk to you about our ambassadors program. But first, a little background of what went into developing this survey. ecoAmerica does a lot of research to, as Layla mentioned, to figure out how to better connect with a broad diversity of Americans. And we conduct a lot of types of research to inform our work. We share it broadly with anyone working to engage Americans on climate, such as you all. So, the important thing is we don't guess. We do deep values psychographic research to really help us understand which Americans are ready to move and how to move them, what else they care about, the depth of what they care about, and really how to connect what they already care about, their values, with solutions in authentic ways. We also do communications research to understand the best ways to approach communications. We also do research on message testing for the exact words, phrases, and full messages that move Americans, that inspire them to action. And we also provide this as a stepwise process guide in our 15 steps. So we have values research, 15 steps that is a great stepwise process for you to follow to create your own authentic message. And we also have tested messaging on climate and health and many other categories with other reports to really help folks speak effectively about climate change in ways that resonate personally with Americans. We also do topical research, and some of you might be familiar with our mental health report that we did in collaboration with the American American Psychological Association. And you can find all of this research on the ecoAmerica website and also through Climate for Health as well. The other thing we do is polling. We do polling to measure where Americans are in any certain given time of the year. But specifically, we do our American Climate Metrics Survey in September of every year to measure folks on an annual basis. We offer this research through our partners to our partners as well. And so that's what we're going to take you through today. NEHA has participated in the research that we have done for American Climate Metrics for over 2 years now. It's important to note that we've been fielding this metrics research for about 3 years. And what we do with it is we field nationally. So we have a nationally representative sample. NEHA has participated over the last 2 years, and what that allows us to do for NEHA is compare the results not only to the national sample, but also for NEHA members year over year. And so that's what we're going to provide you really a preview of today. You might also recall that Bob Perkowitz, ecoAmerica's founder, shared the findings of last year's survey at the Educational Summit last year. So we're happy to be able to bring that forward to this year's summit. As I mentioned, we do surveys nationally with a representative sample of American adults. We also do key cities such as LA, New York, Chicago, and Salt Lake to get some regional findings as well. We offer those through the ecoAmerica website. So why we provide this, why we collaborate with NEHA on this, is we really want to help give NEHA, as well as you all, valuable information to inform your climate work. It also helps NEHA see areas of their climate program that are being most impactful and are most useful, and opportunities to expand capacity to help you as members learn more about how climate affects environmental health and what you can do about it. And so, for instance, we learned this year that while there were remarkable year-over-year growth in some areas of climate awareness and attitudes among NEHA members, there were also some areas in which NEHA members were at par, even below levels of Americans generally. So some of the results we're about to show specific areas where NEHA and ecoAmerica and Climate for Health program can refine our training modules and tools and resources and really help deepen inspiration and engagement on climate solutions. So why don't we dive right in? The first finding we're going to preview is on awareness and concern. And overall, NEHA members are aware climate change is happening, but they have slightly lower concern levels. There's a bit of a typo on the screen. I'm sorry about that. So you can see that NEHA members have increasing awareness that climate change is happening and that is caused by human activities. In these two categories, the members are at 86% and 32% respectively, with increasing trends year over year, so comfortably above the national average. But there's also an increasing trend in noticing more severe weather. However, the levels are still below national averages. So remember, the national survey is nationally representative, so respondents come from cities nationwide just like NEHA members. So it's key to point to see how those differences, how we are seeing those differences. So additionally, while a majority of NEHA members are concerned about climate change, the level of concern is notably below the national average. So 71% of NEHA members are concerned, which is a solid majority, but there is certainly room to grow in this area. So this finding is one of the reasons that NEHA is collaborating with us to host the ambassador training at the conference, which we'll discuss in a minute. So on to benefits. We don't just survey how people are concerned about climate change. We also want to understand explore their awareness of the benefits of climate solutions. So Americans often hear that climate solutions will come at a cost, when the fact is that the opposite is true. Those of us on the phone know that climate solutions benefit our health. They can benefit local economies and even jobs. And new research comes out every day touting how clean energy is competitive and often now cheaper than fossil fuels. But it's clear that the American public still have room to grow to understand these benefits, as well as NEHA members. So NEHA members are recognizing the health benefits of climate, but at slightly lower rates than Americans do nationally. So it's a big opportunity for education. Through our partnership efforts and the tools and resources we will launch this year, we hope that you'll see a notable leap above the national average in the next survey. So in these results, we do see some promising leaps in understanding of the economic benefits and the jobs benefits of climate solutions at 55% and 56% respectively, jumps of, significant jumps over year. However, it's clear that these results fall below the national averages. And what we think that is affecting that is this perspective of the cost of energy. And so you can see here that 61% of NEHA members believe that the cost of energy will go up if the U.S. took steps to prevent climate change. So it's above the national average, and we think that is the economic factors are what's clouding the other health benefit perceptions. So on to solutions. Overwhelmingly, NEHA members support modernizing the electric grid. It's 94%. It's hard to get 94% of Americans to agree on anything, so this is a vast majority who really do favor modernizing our grid well above the national average. For wind and solar, 64% of NEHA members think the U.S. should be producing much more wind and solar than it is today. It's still a majority, but as you can see, it is notably below national average and a dip from the prior year where NEHA members, said 73% of NEHA members said that we should be producing much more wind and solar. What we think might be also affecting this perception is the finding we see next, which is wind and solar are the lowest cost energy sources for consumers. Only 26% of NEHA members believe this versus 47% of U.S. national. And so again, I think what we are seeing here is the cost perception is clouding support, and it's also causing it to wane at a time when the reality is that solar prices in particular are plummeting and are often the lowest cost. Moving on to engagement and motivation, we see some good news here. The 4 categories on the slide show clear progress and opportunities for NEHA in the efforts to lead and engage members on climate change. So members are seeing dramatic rises in the association, talking to the public about climate change from 8% in 2006 up to 33% in 2016 to 2017. Certainly there's opportunity for continued growth, but this is great progress. And also that the professional association is educating staff and members about climate change. We see almost a doubling from 16% in 2016 to 30% in 2017. So a lot of great progress there, and as we noted, hoping to see a lot more growth over the next year as we collaborate on and offer more tools and resources and training in this area. The great and very hopeful finding here is that 70% of NEHA members wish their organization would do more to address climate change. That is quite a majority. It's double that say that they are noticing it. So it really points out an opportunity to do more. And nearly 8 in 10 of NEHA members believe that health organizations and professionals can and should inform policymakers about the health benefits of climate solutions. So this is also a high majority and really shows, again, a real want, need, and interest in doing more with NEHA on this, and an opportunity for others to get trained with the ambassador program. And so that really covers the preview of the findings that we're going to share today, but I want to invite all of you to join us at the full briefing that's taking place at the conference on June 27. And we will go into greater depth of the survey findings. What you can expect is a deeper dive into the survey, more of the questions that were covered, being able to discuss the implications not only generally but as a group, and really how the findings impact NEHA's work over the next year. And then what you'll see on the slide next is the briefing date and time. It's on June 27th at 3:30 p.m., and I believe it's for 50 minutes to an hour. So we hope you'll join us then. Okay, on to the Climate for Health Ambassadors Program.
Thank you so much, Megan, for providing a great summary of the survey results. And as she mentioned, there will be a deeper dive into the results during the AEC session. Megan will now share an overview of the Climate for Health Ambassadors Training Workshop that will be part of the Climate and Health track also on June 27th.
Great, thank you. Americans are witnessing and experiencing climate-related impacts on their health, their livelihoods, and their communities. And they're increasingly looking for guidance on solutions from leaders in their daily lives, health leaders like you. On top of this, as we saw in the polling results preview, NEHA members believe you have a role in engaging the public and policymakers on the health benefits of climate solutions. So NEHA members are also conveying that NEHA should be doing more to address climate change. This is why NEHA and ecoAmerica are collaborating to provide the Climate for Health Ambassadors Program. And really it's a training to help you understand and convey the links between climate and health, the spectrum of solutions that are available, and help you speak effectively on the topic. Also provide you opportunities and ideas to act and advocate on solutions. The training is a little over 3 hours, and it it is going to happen at this upcoming June conference. It'll equip you as health professionals with the knowledge, hands-on experience, and resources to speak and act confidently on climate change and climate solutions. And that's really important to be very solutions-focused. However, we will dive deep into the climate impacts and climate change itself. So with the training, you will be able to engage your colleagues, the public, policymakers, to inspire climate solutions, really that help protect the health of our families and communities now and ensure a prosperous, just, and secure future. Some of the things you see on this screen are just a preview of the kind of content that we will be sharing in the training. We have a very in-depth section on the health impacts of climate change. Just one of them is infectious disease, and we'll really go into a depth of information about how infectious disease is increasing, as well as provide you with all the source materials so that you can be confident that all the information that is being shared is sourced by the latest and greatest research. So the training itself has 3 segments and 6 modules. And what we will cover in the training is a segment on impact. Generally, Climate 101. How is our climate changing? What is climate change? And really with an illustration of how it is changing even as we speak. There's a very in-depth section, as I mentioned before, on the impacts on health. That covers the spectrum from physical health to mental health to community health. There are 10 different categories on the impact, and we go in great depth on that, provide you, as I mentioned, all the source material so that you can feel confident that is the latest information on the health impacts, especially on vulnerable communities, which we also pull out separately so that you can really understand who are the most vulnerable and how. The other module that we will go into after impacts are solutions. So it's not enough to understand, how climate is impacting health. It's really imperative that we understand what solutions are available. And so we will cover the climate solutions that are out there at all different levels, internationally, nationally, regionally, state-based, locally, and even personally, what we can do as individuals. We also will then go into the health benefits. As we saw in the survey results, not enough NEHA members understand the benefits writ large of climate change, and specifically the health benefits. There's room for growth there. So we will go into the health benefits as well. Throughout this, we're really talking about how to talk about the issue. So while it is training and informational, we're also training as we go how to talk about climate, how to talk about the impacts of health and solutions and so forth. But the third and last segment really focuses on how to speak about climate change generally and how to create your own authentic message. It's important that each one of us has a personalized message that's relevant to not only who we are as folks, but who we're speaking to. And so that's a whole module to really give you not only information, but the opportunity to have hands-on practice to start developing your own message. Finally, we'll end with ways that you can engage on this issue personally, within the association, within your community, and nationally. So we'll really get into that engagement on climate. And so going through the training, not only will you receive the training, but you will also receive many other things. We will provide you a 1-hour version of the training to use in your own presentations. So really to give you the tools you need to go out and inspire others on climate solutions. We'll provide you the handouts with notes and citations for each slide. And of course, this includes talking points for you to use and to customize. We'll also provide you access to a website with these materials and recorded webinars so that you can have ongoing refresh of the training. We are also supporting NEHA with helping them to customize the content to make sure it's the most relevant for you as environmental health professionals. We'll be training up one of the staff members to co-present and to be able to hold follow-on trainings. We hope to have multiples of these so the most NEHA members can participate as possible. And of course, being able to offer other materials for you and helping you engage others on climate and health. So the workshop for the Ambassadors Training is going to be held on June 27th from 8 a.m. to 11:20 a.m., bright and early in the morning. So grab your coffee and come join us. We'll be grabbing some coffee as well. It's 3.5 hours to be able to get through the content, but also, as I mentioned, to be able to provide opportunities throughout the entire workshop to pause and practice talking about climate change. So there's a lot of hands-on experience that we'll be doing throughout the workshop, and we'll keep it lively and great for everybody. So I encourage you to join us. So we just want to summarize by putting this information up on the screen. As we've noted, there's a briefing on June 27th at 3:30 for the deeper health survey results, and as I noted, the workshop is earlier that day from 8 to 11 a.m. And I think I'm turning it back over to Vanessa. Is that correct?
Yes, thank you again, Megan. That was a wonderful preview of the Climate for Health Ambassadors Training. Now we will move into the Q&A portion of the webinar. If you have a question, please feel free to type it into the chat box at the lower left-hand corner of your screen. All right, I actually have a question. Oh, here we go. Will this webinar be available for replay? Yes, it is. It will be, and the message will be going out and provided on our website, hopefully in the next couple of days. And I will send out a notice to all the participants of that information. Any other questions? I have another question. Will there be an interactive hands-on part of the Ambassadors Training? If so, what will the interactive part involve?
Sure. There will be several interactive parts of the Ambassador Training. With each module, we will have an interactive session. The first one being about the impacts of climate change on health and generally on people and on health. And we will have a moment to really sort of dive in on how we can practice talking about that and really making it personal. What people are seeing in their local communities and how they can articulate that in their own narrative. We will also, in the engagement section, do two different exercises. One will be to receive a message about climate change and apply the learnings from from the workshop to editing that message. And this really gets people warmed up to language and how to spot what is successful messaging and what is unsuccessful messaging, what can motivate people and what really turns people away. And really warms them up for the second part of the hands-on workshop, which is that you will start to draft your own message, and you'll get to choose from whether or not you're having a conversation or you're making a presentation. You'll be able to choose who is your audience so that you really understand that communications are very audience-focused. And then you'll also get to choose really what, like I said, what kind of message or communication you'll be doing, which is, again, either is it one-on-one conversation, is it an op-ed, is it a presentation, and so forth. and you'll work in small groups. You'll first draft your message, and then you'll work in a small group to really share what you're testing out and get people's feedback on it, and really help each other to really improve our, not only the message, but our confidence in giving the message.
Great. Thank you so much, Megan.
Mm-hmm.
There's another question. Do we have to pre-register for the ambassador training? No, I will answer that. You do not have to pre-register. It is part of the conference registration. If you register for the full conference, it will be part of that. If you register for just that day on June 27th, it will be included in that as well. And that is in our climate and health track on that day. Any other questions? I have another question. Will there be examples of successful communities as part of the ambassador training?
Yes, we actually, as part of the engagement section and riddled throughout, really, also in the solutions section, we do give case studies of different health organizations that are leading on climate and the various ways they're doing so, from reducing their own pollution to engaging their professionals or communities on climate solutions. Absolutely, we believe that success stories are essential in giving folks an idea of how they can implement their own climate leadership at a local level.
Great. Thank you again, Megan. Are there any other questions? All right. It looks like that is the last of the questions. I encourage everyone to access the NEHA website on its climate change and health webpage to access these ecoAmerica and Climate for Health resources, as well as the NEHA resources. A lot of these resources that have been discussed during the webinar are available on the NEHA website as well as ecoAmerica's website. So I encourage you to take a look at those. And again, the webinar and documents that are part of this webinar will be provided to the registrants afterwards. Again, these two AEC Climate and Health sessions will be both on June 27th, Climate for Health Ambassador Training at 8 a.m. to 11:20, and the Climate Change and Health Survey results at 3:30. For more information, please visit the NEHA website at www.neha.org and click on the AEC banner. Thank you again to Megan and Layla and all the ecoAmerica staff who made this webinar possible. And thank all of you for taking time today to join us. We hope you found it valuable. Please be sure to complete the webinar exit survey. Thank you again and have a wonderful day.